and today I'm making a video. The first video that I made about studying with me, a story session, and it's important because I need to study for my test. There is this week, basically. And then I'm making this video in order for me to memorize more the content. So let's start. I'm going to start reading a ebook with the higher information and is in the first time is about diseases. So the first disease is Addison disease. You know that in Addison disease there is a problem and there is an autoimmune disease when antibody going to against the adrenal glands. You know that the adrenal glands is composed by the zona glomerulosa, the zona reticularis, the zona fasciculata, and the medulla. So the zona glomerulosa secretes aldosterone, the zona fascicular secretes cortisol, and the zona reticularis is secretes dihydrosterone. So when there is a problem in one of two of the adrenal glands part, there is going to be a problem in the body. For example, when there is a loss low aldosterone, you are going to see Addison disease. And Addison disease can be caused by many things like infection, HIV, autoimmune process, etc. So the high information is that the zona fasciculara secretes cortisol and the zona glomerulosa secretes aldosterone. When there is low aldosterone, you're going to see hypotension, you're going to see hyponatremia, low bicarbonate, and low potassium, so hypokalemia. This is important because you need to make a difference between Addison disease and Cushing disease, or when there is excess of cortisol. You know that the hormone cortisol is a catabolic hormone. So you're going to see hypertension, you're going to see hypernatremia, you're going to see when people have like the hump increase and stria, you're going to see many catabolic effects in the body. So Addison disease. Addisonian anemia is a pernicious anemia when there is antibody to intrinsic factor of Pareto cells and interferon gamma is decreased and vitamin B12 is decreased. So you're going to have a megaloblastic anemia. Remember that a megaloblastic anemia is composed by increased and numeral of neutrophils. Remember that, for example, in vitamin B12 deficiency and folate deficiency, there is going to be a megaloblastic anemia. A megaloblastic anemia in the folate and B12 deficiency is very present and is high. You're going to see the big neutrophils. So this is important because, for example, I know I'm talking about Addisonian anemia, but folate deficiency, you are going to see a decline in the perception of the person. Like you're going to see a decline in the memory, and remember that folate deficiency and vitamin B12 can be in alcoholic patients, and there can be like in the chronic infections and when there is a surgery in the stomach. Also, it's important to remember that vitamin B12 is with neurologic deficits, but folate doesn't show neurologic deficits. Collagen. Yeah. Albright's syndrome is a polycystic fibrous dysplasia, precocious pulmonary catalysis post short stature in young girls. Alport syndrome is a hereditary nephritis with nerve deafness. Alzheimer's. Alzheimer's is very high over the board. Like when you see an old patient with a decline in the memory, you are going to think about Alzheimer's disease. And Alzheimer's disease is caused by deposition of the tau protein or the precursor tau protein in the brain, specifically in the hippocampus and the basal ganglia, the basal ganglia. So remember also that Down syndrome is is related to Alzheimer's disease because the beta amyloid protein is increased in the chromosome 21. So you know that Down syndrome, I think there is a person connect. The Down syndrome is a trisomy of the chromosome 21, and the beta amyloid protein is increased in that chromosome. That's why you're going to see Alzheimer's disease related with Down syndrome, and Down syndrome is also related with the leukemia. I think lymphoid leukemia. So that is about Alzheimer's. Arthur Robinson pupil is a loss of light reflex contrition in contralateral or bilateral. It's characterized by protectus eyes accommodate but doesn't react. It's pathognomonic for tertiary syphilis and is a lesion in the region of superior colliculus. When I think about protectus eyes, I always think about Graves' disease. And you remember that Graves' disease is characterized by antibody against the TSH hormone. And I think it's IgG, yeah. And in Graves, you're going to see like hypertension. You are going to see many things like when the people are altered or the person are like you know, with hypertension, tachycardia, and all these things. Arnold-Chiari malformation. Arnold-Chiari malformation is a cerebellar tonsil herniation through foramen magnum and C. thoracolumbar meningocele. You know, in Arnold-Chiari malformation, you remember that you're going to see a CT of the brain. And you're going to see like that herniation or tonsil herniation to the foramen magnum. It's common in children. Barrett's is a collural metaplasia of the lower esophagus and is characterized by an increase in adenocarcinoma and is produced by content gastroesophageal reflux. So GERD, that is gastroesophageal excessive reflux. You remember that is characterized by H. pylori. H. pylori is I think it's a gram-negative bacteria, and you can test it in the urea breath test. And also, uh, when there is so much reflux, is going to be related to the loss of the lower esophageal sphincter, and then you're going to have reflux from the stomach to the esophagus. And when there is a set of that reflux, you know that, for example, there is the esophagus and there is the stomach. The stomach is composed by uh, columnar cells, and the esophagus is by epithelial not ciliated cells. So when there is a metaplasia, is when there is a change in the cells. Well, uh, I also mentioned the antrum when there is in the lesser curvature when there is the high risk deposition of the reflux. Becker's muscular dystrophy is similar to Duchenne but less severe and is a mutation or a deficiency in dystrophin protein. Basic muscular dystrophy is a mutation. Bell palsy is a palsy in the cranial nerve 7 and is entire felt, and recall that upper motor neuron lesion only affects lower face. So Bell palsy is when the person has like a drop in one of the part of the face. Beggar, Beggar disease is a IgA nephropathy causing hematuria in kids, usually following infections. So, uh, Beggar disease, when you see like a kid with infections and you see hematuria, etc., you're going to think in IgA nephropathy, or you also going to think about um, post-streptococcal glomerulonephritis. Remember that post-streptococcus is caused by sore throat or impetigo, any respiratory infections that can be characterized by um, Streptococcus group A, and it's going to be and going to produce a nephritic syndrome with hematuria, with an inflammation in the kidney. Bernard Sollier disease is a defect in platelet adhesion, abnormal large platelets, and lack of platelet surface glycoprotein. When you think about platelets, remember that von Willebrand disease. Von Willebrand disease is a defect in platelet adhesion, and you're going to see like kids with excessive bleeding, nose bleeding, or when there is a extract of the teeth and going to bleed a lot. It's characterized by normal PT and PTT, I think. Berry aneurysma is in the circle of Willis is by subarachnoid bleed in the anterior coronary artery. Is often associated with autosomal dominant polykidney disease. You know that polykidney disease can be autosomal dominant or autosomal recessive. Autosomal dominant, remember, there is 50%. Autosomal recessive is 25%. And the circle of Willis, subarachnoid bleed in the anterior coronary artery, in the anterior coronary artery, the anterocerebral artery. Very aneurysm. Very aneurysm. You're going to see like a kid with problem in the kidney and problem in the brain. Bowel disease is carcinoma in situ, a shot of penis, and risk of visceral carcinoma, compared with KRAT. Burn sensor disease, recurrence or rickettsia prowazekii up to 15 years later. Burkitt syndrome, a somatization disorder, psychological, multiple physical complaints without physical pathology. You remember that factitious disease is when the person is like faking a disease and there is nothing like proving that the person is sick. Broca aphasia. Broca aphasia is high yield because you remember in the brain, usually in the left part of the brain, you're going to have the Broca and the Wernicke area. When there's a problem in the cerebral artery, like an ischemic infarct, like a stroke, you're going to have problems with the speak or the understanding. When there's a problem in the speak, is like Broca aphasia. When there's a problem understanding, is a Wernicke. So you're going to speak in is not going to understand anything. There is word salad. Remember that is in the cerebral artery. Brown sequence is an emission of core contralateral loss of pain and temperature. Ipsilateral loss of fine touch, upper motor neuron, ipsilateral loss of conscious proposition. So remember, this is also high, and it's hard to understand when there is a problem in the vertebra, and you are going to lose temperature, pain, etc. So Broughton disease is high when you see a kid with problem with many infections, recurring infections. You're going to think about you are going to think about Broughton disease when there is a problem in the B cells. B cells. Remember the B cells is the primary immunity. So I'm very sorry for that, but it is what it is. Well, I think it's not a problem at all. Hallelujah. So Budd-Chiari is a post-hepatic venous thrombosis, abdominal pain, hepatomegaly, ascites, portal hypertension, liver failure. So Budd-Chiari is when there is a problem in the liver and it's a thrombosis and it's post-hepatic venous thrombosis. You're going to see hypertension, abdominal pain, ascites, hepatomegaly, portal hypertension, liver failure. Budd-Chiari is important. Becker disease. Becker disease is an acute inflammation of medium and small artery or extremities. Painful ischemia, gangrene, seen almost exclusively in young and middle-aged men who smoke. So you remember about DVT, deep venous thrombosis. DVT is like in hypertensive, hyperlipidemia patients and also diabetes mellitus. And DVT is important because DVT can cause a PE. There is a pulmonary embolism. And also remember that uh, Virchow triad. There is lesion is uh, lesions injury can be hypo hypercoagulability and this problem with the blood. Now, remember that in diabetes patients can also cause nephropathy when there is a loss of sensation and in the foot. Burkitt's lymphoma is a small non-cleaved cell lymphoma. Can be by enterovirus virus. An enterovirus is a DNA virus. Is I think is naked. So remember there is 8-14 translocation. Seen commonly in jobs, abdomen, retroperitoneal, soft tissues, and stories K appearance. Epstein-Barr virus. I know that Kawasaki is caused by Kawasaki virus, and scarlet fever. I think scarlet fever is caused by Epstein-Barr virus. And can cause Burkitt's lymphoma also. A14 translocation in the jaw, sore throat. Yeah. Caisson disease is a nitric gas embolism. Chagas disease is a trypanosoma infection, cardiomegaly with apical atrophy and achalasia. Remember that Chagas disease is important when a person has traveled to the Africa and South or America and you're going to see cardiomegaly, heart problem, heart failure. Shediac-Higashi disease is autosomal recessive, phagocyte deficiency, defect in the microtubule polymerization, neutropenia, albinism, cranial and peripheral neuropathy, and repeated infection with strep. Combs syndrome is primary aldosteronism, hypertension, retained sodium, and bicarbonate hypokalemia causing alkalosis and loss of renin. You see the difference between primary aldosteronism and Addison. Cory's disease, type 3 glycogenesis, glycogen storage disease, is a debridement enzyme amyloid 1.6 glucoside deficiency, and glycogen is increased. I don't understand that much about biochemistry. Creutzfeldt-Jakob is a primary infection, cerebellar and cerebral degeneration. Crigler-Najjar syndrome is a congenital hyperbilirubinemia conjugated glucuronidinotransferase deficiency. This is important, glucuronidinotransferase deficiency, and can progress to kernicterus. Less severe form will respond to phenobarbital therapy. Corlin ulcers is acute gastric ulcer associated with severe burns. Cushing. We came to Cushing. Cushing is also higher, and I talked about Cushing already. And there is a difference between disease and syndrome. when there is a disease, it's a problem in the pituitary gland. When the pituitary gland, there is the river for the surface ectoderm of the Jacob pouch. Yes. And the anterior gland of the pituitary gland is going to secrete so much as ACTH, and ACTH is going to the zona fasciculata, and it's going to secrete a lot of cortisol, and the cortisol is going to produce a moon face, a buffalo hump, what I talk about, buffalo hump, purple striae, hirsutism, hypertension, hyperglycemia. So remember that a basophilic adenoma or adenoma in the pituitary gland can produce a lot of cortisol. And when there is a lot of cortisol, it's going to produce all of this I talk about. The syndrome is a hypercorticism of all other cause and primary adrenal or atopic. So remember that when there is Cushing disease, you're going to make a dexamethasone test. So dexamethasone is going to inhibit ACTH, and low dexamethasone can inhibit ACTH. But if not, you're going to think about the problem in the pituitary. I think it's, yes, that. So I already talked about Addison disease, megaloblastic anemia, Alzheimer's disease. I talk about Down syndrome. I talk about Arnold-Chiari, Barrett, Bell palsy, Berry aneurysm, Broca fascia, Broughton disease, Budd-Chiari, Burkitt's lymphoma, Chagas, Chediak, Crohn's. Oh, I didn't talk about Crohn's, and Crohn's is very important. And you know that you need to make a difference between Crohn's and ulcerative colitis. Crohn's is a transmural inflammation. So it's an inflammatory bowel disease in the ileocolon, transmural, skip lesions, club stone formation, lymphocyte infiltrate, and granulomas. So when you think about Crohn's, you think about there is skin happens in the mouth to the adult, and it's going to be skip lesions. It's not a continuous lesion. Continuous lesions is in the ulcerative colitis. And ulcerative colitis is colon, mucosa, and submucosa. Is characterized by quick absence, pseudopolyps, and a risk in colon cancer. Clinically, abdominal pain, diarrhea, fever, malaxation, fistula between intestinal loop and abdominal structure. You saw the difference? I'm a very, I'm sleepy a little bit, but it's because I slept like for 5 hours, I think. The Kervan's thyroiditis is a self-limiting focal destruction, subacute thyroiditis. Endocrine system is important. In endocrine, you're going to remember about hypothyroidism and hyperthyroidism. Hyperthyroidism, I talk about Graves' disease, there is HAIO, and hypothyroidism, Hashimoto thyroiditis. And both Graves and Hashimoto is autoimmune. And Hashimoto's is antibody to the thyrogram, and you're going to see low T3 and T4, and high TCH and TRH. And in grapes, you're going to see aseptic T3 and T4 and low TCH. Okay. DiGeorge syndrome is a failure in the third and fourth pharyngeal pouches formation. Remember that the third and fourth is going to form the thymus and the parathyroid. The thymus is the third and parathyroid is the fourth. And it's important because when there is DiGeorge syndrome, uh, DiGeorge syndrome, I think is caused by 21q malformation, and is hypoparathyroidism, can be characterized by tetany, can be characterized by thymic hypoplasia T cells deficiencies, and also DiGeorge syndrome is going to be characterized by a defect in the labes. Yes. And it's characterized also by many infections. Why? Because there is a thymic hypoplasia and T cell deficiency. So you know that the T cells is maturated in the thymus. So there is no thymus, there is deficiency of T cells, there is going to be many infections. Now, Down syndrome is a trisomy in chromosome 21 or a trilocation. Down syndrome is very high. Down syndrome, you're going to see like problems in the heart, problem in the blood, problem with disability is the first cause of disability, and the second cause is Fragile X syndrome. And Fragile X syndrome is but missense mutation or silence mutation. I think it's silent mutation in the FMR1, and in the Fragile X syndrome, you're going to see disability. You're going to see, I think, macrosomy. Yes, I think so. So, and it comes in boys. Dressler syndrome is post-myocardial fibrinous pericarditis. It's autoimmune. So remember that when there is a myocardial infarction, you're going to see some changes, microscopy, and thank you. Obrigado. Obrigado. Bom, when there is a myocardial infarction, there is some changes in the, like you're going to see first in the 0 to 4 hours, you are going to see no change. And in the 5 to 12 hours, you're going to see infiltrative neutrophils. Then the 1 to 3 days, you're going to see macrophage infiltrate. And then you're going to see like scar formation, collagen type 1, that is also in the tendon. And also, in the first hours, a person who has passed by a myocardial infarction can die by a ventricular fibrillation and or ventricular arrhythmia. And also, it's important because you're going to see a troponin increase, and troponin increase means a lesion in the cells, and irreversible. This is very important because in myocardial infarction, cuando hay un infarto en el miocardio, there is a CT elevation. The segment, the CT elevation, you are going to see it in the D2, D3 y ABF. And this is an inferior lead infarction. And is common in the right coronary artery. And in the right coronary artery is 80%, 85% of patients dominant. Good. So, Dressler syndrome, what I was talking about, it was like there is so much inflammation, there is so much infiltration of neutrophils that is going to produce a pericarditis. Dubé-Johnson syndrome is a congenital hyperbilirubinemia that is conjugated. Bilirubin transport is defecting the conjugation, and a string brown to black discoloration of the liver. So Dubé-Johnson syndrome, when you see like brown to black discoloration in the liver, you're going to think in hyperbilirubinemia that is conjugated. Duchenne muscular dystrophy, and this is important because this is a deficiency in dystrophin protein, and is a S-linked receptor in going to produce muscular dystrophy. Duchenne muscular dystrophy is characterized by Gower sign when the kid put her hands in the floor to rise up. Good. Edwards syndrome is a trisomy 18, Rockenbauer feet, low ears, a small lower jaw, and heart disease. Edwards syndrome, remember Edward is trisomy 18 and Patau is trisomy 13. Patau syndrome is more like Patau because there is a problem in the labs also. There is polydactyly finger more, and also characterized by heart disease. Good. Ehlers-Danlos is a collagen defective, and Ehlers-Danlos is a boy with problem with excessive collagen and Semmenger's complex, late cyanotic shunt, right to left, pulmonary hypertension, right ventricular hypertrophy, secondary to long-standing ventricular septal defect, outer septal defect, and patent ductus arteriosus. Erb's-Dodson palsy, trauma to superior trunk or brachial plexus. There is a weighted tip. Weighted tips is like when the weighted is asking for tip. But now I can see that this is a brachial plexus lesion. I didn't remember about this. And this is a trauma to superior trunk. So, Ehlers-Danlos palsy, trauma to superior trunk. Ewing sarcoma is a malignant undifferentiated undifferentiated round cells tumors of bone in boys. It's a translocation in chromosome 11 and 22. Oh, Fanconi syndrome is an impaired proximal tubular resorption secondary to lead poisoning or tetracycline. So you're going to see glycosuria, hyperphosphaturia, aminoaciduria, and systemic acidosis. And lead poisoning, you're going to see acidosis, non-anion gap metabolic acidosis. And lead poisoning is common in people that are in the farm. And this is important because you have to differentiate it from carbon more acid poisoning when there is repupills, confusion, and headache. Erythroplasia occurred carcinomas in the gland penis. Fanconi syndrome is an impaired proximal tubular resorption secondary to lead poisoning or tetracycline, glycosuria, hyperphosphaturia, aminoaciduria, and systemic acidosis. Felty syndrome is a rheumatoid arthritis, neutropenia, and splenomegaly. Gardner syndrome is autosomal dominant adenomatosis polyps of column, osteomas, and soft tissue tumors. Gaucher disease. Gaucher disease is very important. Why? Because this is a problem in the brain, and you're going to see hepatosplenomegaly, femoral head and long bone erosion, and anemia. It's a lysosomal storage disease. So remember, you're going to see hepatosplenomegaly, anemia, and bone eruptions, and there is a defect in that glucocerebrosidase deficiency, and it's accumulation of glucocerebroside accumulation. Bro. Jever syndrome is a benign congenital hyperbilirubinemia unconjugated, characterized by deficiency in glucuronide transferase activity. Plasma thrombasthenia is a defective glycoproteins on platelet deficiency platelet aggregation. Goodpasture is a type 2 hypersensitivity reaction. So, type 2 hypersensitivity reaction is characterized by antibodies. Yes, antibody IgG, IgA. Yes. Contact dermatitis is a type 4. Asthmatic is a type 1. Lupus is a type 2. And I don't remember if it's a type 3. Lupus. I think it's a type. Is subtitled is antibody to glomerulal and alveolar basement members. See in men in their 20s. Graves' disease. Do you remember that we talked about Graves' disease? So you're going to see it now. This autoimmune hyperthyroidism, IgG antibody reactive with TCH receptor, low TCH and TRH, and high T3 and T4. You see, I talk about this. Guillain-Barré. Guillain-Barré. Guillain-Barré can be by a wound injury, and is polyneuritis following viral infections, autoimmune, and is muscle weakness, paralysis, and usually left limited. Ascend the muscle with remember that is in the challenge cellular dystrophy. Good. Hammer-Rich syndrome is an idiopathic pulmonary fibrosis can say honeycomb lung. Hans Scholar Christian is chronic progressive histiocytosis. Hashimoto thyroiditis is an autoimmune hypothyroidism, may have transient hypothyroidism, low T3, T4, and high TSH. Hashimotosis, initial hypothyroidism in Hashimoto thyroiditis that precedes hypothyroidism. Hesno-Scullen purpura is a hypersensitive vasculitis. Allergic purpura, lesions have the same age. Hemorrhagia urticaria with fever, arthralgias, gastrointestinal and renal involvement, associated with upper respiratory infections. This is important. Why? Because you're going to see renal problems. Also, you're going to see hypersensitive vasculitis, fever, arthralgias. Hirschsprung disease is an aganglionic megacolon. In this, there is a defect in that Chris cells migration. Chris cells migration. This is how. Horner syndrome is a ptosis, meiosis, anhidrosis, lesion on cervical sympathetic nerves, often secondary to Pancoast tumor. So remember the Pancoast tumors is a tumors in the lung, in the superior lobe of the lung, is going to produce ptosis, meiosis, and is also characterized by a cervical lesion. Good. Huntington is a chromosome 4 and is characterized by progressive degeneration of caudato, nucleus do caudado, putamen, striatum, and frontal cortex. There is a decrease in GABA. So, Huntington is characterized by problems en el comportamiento, is aggressive, and you need to recognize that Lewis dementia, no, frontotemporal dementia is characterized by also problems in the comportamiento. Y Lewis body dementia. Lewis body dementia. Pick disease. I think also is the same. I don't remember very well. So, Huntington, Jacksonian seizures is an epileptic event originating in the primary motor cortex. Jacksonian seizures is common in young patients. Remember that when there is seizures, there is a problem in the brain characterized by excess sodium and glutamato. And you need to memorize the mechanism of actions of the valproic acid, phenytoin, and carbamazepine and lithium. So most of them work inhibiting sodium exceptions. Good. Job syndrome. Immune deficiency. Neutrophils fail to respond to chemostatic stimuli. Defect neurotrophic chemostatic response, repeated infections, and commonly seen in light-skinned, red-haired girls. And is characterized by an increase in IgE levels. Kaposi sarcoma is a malignant vascular tumor por HSV-A in homosexual men. Kaposi sarcoma. We talk about Burkitt lymphoma. There is A14. So, Cartagena syndrome is a immotile cilia secondary to defective DNA arms infection cytosine versus sterile. Cartagena syndrome, primary ciliary dyskinesia, is a problem in DNAM arm, and you're going to have bronchiectasis, you're going to have cytosine versus, remember the pictures, and you're going to have like sterility. I think it's a problem in vas deferens. Absence of the vas deferens. Well, Kawasaki disease. Kawasaki, remember, a girl with fever for more than 5 days, strawberry tongue, Kawasaki virus, Biskupia aortic valve. Oh, yes. No, it's aortic dissection, I think. No, acute necrosite vasculitis. Yes. Klinefelter syndrome. Klinefelter, long arms, stereo hypogonadism, 47 SSY. Klinefelters, remember that Klinefelters is with long arms and hypogonadism. Marfan's is different. Marfan's is a different. In the fibrillin, Marfan's is going to have a high stature, but it's not going to have intellectual disability. And Marfan is autosomal dominant. Yes. Kluver's bus, bilateral lesion of amygdala, hypersexuality, and other behavior. Kronberger tumor, adenocarcinoma with ring cells typically generated from the stomach, metastasis to the virus. Ledner cirrhosis, alcoholic cirrhosis. When you see cirrhosis can be caused by hepatitis C, alcohol consumptions, you're going to see portal hypertension, you're going to see ascites, you're going to see sepsis, ammonia in the brain. That's why people going to have confusion. So, uh, Les Nihan is gout, retardation, and cell mutilation. Bro, you need to remember that Les Nihan is going to have problem in the nails by cell mutilating behavior. Is going to have gout, high hypoxanthine, yes, no, low hypoxanthine, and retardation. Do you remember Gaucher disease? Gaucher disease is excessive glucocerebrosidase enzyme, uh, hepatosplenomegaly, lung bone eruptions, and lysosomal storage disease. Okay, Les Nihan. Les Nihan is hypoxanthine guanine phosphorylase 2 enzyme. Lichtman Sachs, endocandid, endocarditis with agitation of all leaflets associated with lupus. Lupus, remember anti-DNA uh, and anti-Smith. Anti-Smith, I think, is more specific. Yes. Remember that lupus is also can be has a false positive BDRL syphilis and uh, lupus can be characterized by arthralgia, joint pain, um, butterfly rash. See. Now, talking about endocarditis. Endocarditis, you remember that, for example, if it's a patient with doesn't use drug, think about the mitral valve. If you use drug, you're going to think about the tricuspid, valvula tricuspide. And also, Staphylococcus aureus is the more uh, common. Can be caused by Candida and Streptococcus pyogenes. Staphylococcus aureus is a gram-positive, coagulase positive. Yes, it's all positive. Staphylococcus aureus. Streptococcus, Streptococcus pyogenes. I think it's gram-positive, but it's it has something negative. I don't remember. And endocarditis, remember that uh, jaw lesions and also in the palms, like vasculitis. Dios mío, pero todavía falta mucho. Ay, padre amado. Deja tomar un poquito de agua porque esto está. Hacer una pausa, ya va una hora. Porque lo merecemos. You got to be kidding me, bro. Ah, hacer una pausa pequeña. I hate flying boy. Oh, padre. Ok, ya yo hice mi,
Ok, ya yo hice.
ya yo hice mi pausa pequeña, ¿verdad? Ya mi cerebro no parece estar mucho, pero voy para encima. Vamos con la otra parte de la sesión de estudio. Que do outro lado, se você chegará, pois ele é rei, mas o dono desse mar. Hum, hum. Ele é rei, mas o dono desse mar. Hum. Okay, let's go. Uh, Lou Gehrig's is amyotrophic lateral sclerosis. It's a degeneration in the upper and lower motor neurons. In upper motor, in amyotrophic lateral sclerosis is by can cause muscle weakness. Yes, and also remember that um, multiple myeloma is characterized by women and protein and let me see amyotrophic lateral sclerosis. Open motor neuron signs, spasticity, hyperreflexia, pathology reflex, jaw jerk, extensor plateau reflex. In lower motor neuron signs, atrophy, fasciculation, bulbar symptoms, dysarthria of the fascia, diagnostic clinical evaluation, uh, electromyography, and MRI of the head and spinal cord to exclude other causes. And treatment is Riluzole, respiratory support, and nutritional support. Uh, so, yes, amyotrophic lateral sclerosis is upper and lower motor neurons. Now, multiple sclerosis is uh, multiple sclerosis, afferent pupillary light reflex defect, optic neuritis, a patient who has inability to look immediately upon contralateral gaze, intranuclear ophthalmoplegia, damage to medial longitudinal fasciculus. Patient just diagnosed with multiple sclerosis, oligonoclonal banding periventricular place, elevate EGG in CSF and periventricular plaques, demyelinating of oligodendrocytes. Flexion of the neck causes increased neuropathic pain, Lyme signs. So, clinical features of multiple sclerosis. Onset, age of 15, optic neuritis, limiting sign, internuclear ophthalmoplegia, fatigue, ophthalmic phenomenon, sensory symptoms, numbness, paresthesia, motor symptoms, spasticity, bowel bladder dysfunction, relapsing disease pattern, relapsing, remitting, majority, primary progressive, secondary progressive relapsing, diagnosing MRI lesion, disseminating, time space, periventricular, juxtacortical, infratentorial, spinal cord, oligoclonal EGG bands on cerebrospinal analysis. So you saw multiple sclerosis, right? Now let's see multiple myeloma. Multiple myeloma is also higher. There is an increase in the Y. So, multiple myeloma is hypercalcemia, renal insufficiency, IgG, IgA light chains, is the monoclonal antibodies, is osteolytic lesion fractures, peripheral smell reloads, and bone marrow biopsies, 10% of clonoplasma cells. So, multiple myeloma, the pathophysiology is plasma cell neoplasm produce monoclonal paraprotein, immunoglobulin. Manifestation, bone pain, fractures, contusional symptoms, weight loss, fatigue, recurrent infections. Laboratory, normal cystic anemia, renal insufficiency, hypercalcemia, constipation, muscle weakness, monoclonal paraproteinemia, and spike. Radiology, osteolytic lesion, osteopenia, osteoclast activation. I think there is everything about multiple myeloma. So, coming back to diseases, Mallory-Weiss syndrome is a bleeding from esophagogastric laceration secondary to Western alcoholic. Mallory-Weiss syndrome, remember that a person drink a lot and is produce laceration of the esophagogastric epithelium. And Marfan's, we talk about Marfan's, there is a problem in the fibrin, and it's a connective tissue defect. And discerning aortic aneurysm, sublation of lenses. Remember that Marfan's is characterized by aortic dissection, mitral valve prolapse. Also, young people die from mitral valve prolapse. And also, Marfan's, you have to differentiate it from homocystinuria. Homocystinuria is characterized by problem in the lens base is down and diplopia. And lens in Marfan is upward. Marcus disease is a type 5 glycogenesis. Glycogen storage disease, most of phosphorylase deficiency in glycogen. Mercus diverticulum is a rule of 2 inches long, 2 feet from the iliacolum and 2% of the population. Embryonic due origin and may have ectopic tissues, gastropancreatitis, remained of vitamin duct gel stock. Mercus diverticulum is important. Mercus skin, stomach, Mercus diverticulum, bladder. I never saw Mercus diverticulum. Pero recuerda epidemiología. 2% prevalencia, male to female ratio, 2% are symptomatic at age 2, located with 2 feet of the iliacolum valve, clinical presentation symptomatic, incidental finding, painless hematochezia and 2 septions, intestinal obstruction, volvulus, surgery for treatment. Yes. Remnant of vitamin duct gel sac. May syndrome, triad, ovarian fibroma, ascites, hydrotoras, associated with fibroma of ovaries. Endometriosis, dyspareunia, dysmenorrhea, endometrial gland in the stomach also. Many Treacher's disease, young hypertrophic gastritis, and large rugged plasma protein lines. Munchausen syndrome, fatigue disorder, conscience creates symptoms but doesn't know why. Fatigue disorders, remember that. Nelson syndrome, primary adrenal Cushing, surgical removal of adrenals, loss of negative feedback to pituitary adenoma. Niemann-Pick, lysosomal storage disease, sphingomyelinase, sphingomyelin accumulation, foamy histiocytes. Osler-Weber-Rendon syndrome, hereditary hemorrhagic telangiectasia seen in Mormons of Utah. Paget's disease. Paget's disease is very high here. Paget's disease, abnormal bone architecture, thickness, numerous fractures, and pain. Paget's is bone pain, hearing loss, osteosarcomas, osteoblastic and osteolytic, alkaline phosphate increase. Yes. Okay. Pancoast tumor. We talk about Pancoast tumor. There is a tumors in the lung. Bronchogenic tumor with superior sulcus involvement and Horner syndrome. Horner syndrome, ptosis, meiosis, anhidrosis, and sympathetic trunk involvement. Parkinson. Finally, we come to Parkinson. Parkinson's dopamine depletion in isogliastal tracts. Remember that Parkinson's is characterized by Lewis-Bory, and also there is peak disease. Peak disease also have Lewy-bodies, Parkinson. So, Parkinson also okay, la sustancia negra has degeneration of dopamine producing neurons. Normal brain, substantial negra inhibits excessive movement. Resting tremors that decrease voluntary movement usually involve the legs and hands, and face involvement is less common. Ujú. También existe lo que es drug-induced Parkinsonism, that is D2 receptor blockers, antipsychoticos, first generation more than second generation, antiemetics, gastric motility agents, metoclopramide, prochlorperazine, symptoms, prominent rigidity, bradykinesia, slow movement, decreased arm swing, tremors, rest, and posture, mask faces, managing decrease or discontinue offending medication, anticholinergics, benztropine. Ok. Y también los antipsicóticos can produce side effects. Extrapyramidal side effects like acute dystonia reaction, sudden onset, sustained muscle contraction, akathisia, subjective restlessness with inability to sit, drug-induced Parkinsonism, tremor, bradykinesia, maze face, tardive dyskinesia, involuntary movement after chronic use, lip smacking, coratoid movement, neuroleptic malignant syndrome, fever, rigidity, mental stature change, autonomic instability. I'm looking for something. But I can't find it. Bueno, recuerda que los, los agonistas D2 son los que trabajan en Parkinson y los antagonistas son los que trabajan en antipsicóticos. Parkinson's. And also, alpha subnuclein is present in Parkinson's. Peutz-Jeghers syndrome. Melanin pigmentation of lips, mouth, hands, genitalia, hematomas, bodies, or small intestine. Remember that melanoma is a tumor of the epidermis, and also is asymmetrical, very metastatic tumor. Okay. Peyronie's disease, subcutaneous fibrous or dorsal penis. Pick disease, progressive dementia similar to Alzheimer's, contrastive pericarditis, sequel to mediastinal tuberculosis, calcium frosting inline layer, heart chambers may be unable to dilate or receive blood during diastole. Plummer syndrome. Plummer syndrome is esophageal with iron deficiency anemia, spoon-shaped naves, and increase in squamous cell carcinoma of the esophagus. Remember las uñas para arriba es en solar plummer syndrome. No, plummer vision. Pompe disease is type 2 glycogenesis. Glycogen storage disease, cardiomegaly, alpha 1, 4, glucoside deficiency, and increased glycogen. Past disease is tuberculosis, osteomyelitis of the vertebra. Tuberculosis is high yield and can't disseminate to the vertebra. It causes pump disease. No puede ser que esta no. Okay, so pathogenesis of pulmonary infection. Primary infection, gum focus, caseating bacteria spread to lymph nodes, forming gum clump complex. Infection latente, dormant bacteria contained within a faucet. Resolution bacteria clearings, progressive primary tuberculosis, immune response results in progressive lung consideration necrosis. Ok, imagínate. Droplets, contaminated droplets, pathogenesis of tuberculosis, Mycobacterium tuberculosis, macrófagos alveolares, inhibing phagocytosis maturation, interleukin 12, TH0, TH1, interferon gamma, migrant to lymph nodes, macrophage activation, epithelial cells, and drugs for treatment of tuberculosis. Rifampin, inhibiting of bacterial DNA depending RNA polymerase. Side effects: gastrointestinal side effects, rash, red orange body fluid, cytopenia. Isoniazid inhibit mycolic acid. Okay, rifampin is DNA dependent RNA polymerase. Isoniazid inhibition of mycolic acid Pyrazinamide is unclear. Hepatotoxicity happened. Ethambutol inhibition in arabinosyl transferase. Ok. ¿Te recuerdas que hablamos sobre S-link a hemoglobinemia, que is a decrease in B cells? Now, severe combined immunodeficiency is when there is a gene defect leading to failure of T cell development and B cell diffusion due to absence of T cell. Is a S-link receptive, is a autosomal receptive, recurring severe viral fungal opportunities, pneumocystis infections, failure to dry, chronic diarrhea, stem cell transplantation is the treatment. So, let's see. Oh, Mycobacterial tuberculosis is a facultative intracellular acid-fast bacillus that is transmitted via aerosol droplet. Tú estás viendo. Bueno, continuamos. Post disease is tuberculosis stimulated of the vertebra. Potter complex renal agenesis, oligodramnios, hypoplastic lungs defects in extremities. Raynaud syndrome is disease recurring vasospasm in extremity and seen in young, healthy women phenomenon. Secondary underlying disease, scleroderma. Reiter syndrome is urethritis, conjunctivitis, arthritis, no infections, but often follows infection. HLA 27, polyarticular. Reger syndrome, microvesicular fatty liver change, encephalopathy, secondary to aspirin injection in children following viral illness, especially varicela zoster virus. Entonces recuerda, no se le da aspirina para los niños, si no le puede causar Reger syndrome. Y Reger syndrome is also in the mitochondria. Entonces, imagina que patofisiología. Aspirina usada para un virus, por ejemplo, varicela o influenza. Entonces, hay una toxicidad mitocondrial. Hay un metabolismo inhibido. Microvesicular fat deposition in the liver. Hepatic dysfunction. Hyperammonemia. Diffuse atrophic swelling. Cerebral edema. So, you're going to see clinical features: acute liver failure, elevate transaminases, coagulopathy, rapidly progressive encephalopathy, vomiting, lethargy, seizure, and coma. Treatment supportive. That's it. So don't give aspirin to children, just in Kawasaki. En aspirin inhiben ciclooxigenase 1 y 2 irreversibly. Okay. Uh, Rheumatoid idiopathic fever plasmodium, Rotor syndrome, congenital hyperbilirubinemia conjugated. Remember that Dobby-Johnson syndrome is a deficiency in the glucuronidase. Yes, and brown to black. And Rotor syndrome is similar to Dobby-Johnson, but not discoloration of the line. Sézary syndrome, leukamia for cutaneous T-cell lymphoma, mycosis fungoides. Travers disease, aluminium inhalation lung fibrosis. Sheehan syndrome, postpartum pituitary necrosis, hemorrhagia, and shock, usually occur during delivery. Entonces, Sheehan syndrome es cuando hay un infarto o una isquemia. I think isquemia en la glándula pituitaria después de un parto. Simple syndrome, men type 2, pheochromocytoma, thyroid medullary carcinoma, hyperparathyroidism. Oye, recuérdate que main type 1 and main type 2 is also autosomal dominant, REPT mutation carcinoma. Espíritu de Dios. Joring syndrome. Dry eyes, dry mouth are treated. Risk of B-cell lymphoma. Síndrome de Joring es cuando no hay lágrimas, no hay saliva. Es algo autoinmune. Deja ver si me acuerdo bien. Ok. Keratoconjunctivitis Zika. Dry mouth, salivary hypertrophy, cirrhosis of skin. Rhinal phenomenon, cutaneous vascular arthritis, interstitial lung disease. Diagnostic finding: decreased lacrimation, screaming thirst, positive anti-RO and anti-LA. Anti-RO, SSA. Jory. Salivary gland biopsy with focal lymphocytic ciliodonitis. Classification primary if not associated. Solo un momento. Sopra chiamura. É preciso, mas necessário. É preciso. I need to. I need to. Okay. Speed nebus. Juvenile melanoma always benign. Stain Leventhal. Polycystic ovary. See amenorrhea, infertility, obesity, incertism, and increased LA secretion. Po- Polycystic ovarian syndrome. Remember insertismo? Remember high testosterone, low progesterone, high LH. Okay. Steven Johnson syndrome. Erythema multiforme, fever, malaise, mucosal ulceration, often secondary to infection, mycoplasma, sulfur drugs. Steven Johnson syndrome puede ser causado por drogas y es un antibiótico. Digoxin. I think it's digoxin. Still disease. Juvenile rheumatoid arthritis. Absent of rheumatoid factor. Takayasu's arteritis. Aortic arch syndrome, loss of carotid, radial, or ulnar pulseless disease, night sweat, common in young Asian females. Tay-Sachs is autosomal recessive, gangliosidosis, isosaminase deficiency, cherry red spots on the macula. Tay-Sachs. Niemann-Pick disease and Tay-Sachs. Niemann-Pick disease is hypoxanthine guanine phospholipid, hepatosplenomegaly, and I think also have red spot in the macula. But Tay-Sachs disease is autosomal recessive. It's a hemosanidase A deficiency. Okay. Tetralogia de Fallot. Tetralogia de Fallot. This is important. Ventricular septal defect, overriding aorta, pulmonary artery stenosis, right ventricular hypertrophy is common in DiGeorge syndrome. Yes. And I think it's also in Down syndrome. No, Down syndrome is vestibular septal defect, ultraseptal defect. Yes. Tourette syndrome. Involuntary absence, both motor and vocal. Turcon syndrome, colon adenomatosis polyps plus CNS tumors. Turner syndrome. Turner. Turner cyst also higher. Remember again. 45 SO Weber neck fusion of the metanephrons and also of various trach and also bicuspid aortic valve and ¿qué más? ¿Qué más? Amenorrhea, infertility, lymphedema, aortic dissection. Creo que eso, ¿verdad? Continuando. Vincent infection. Acute necrocirrhosis eruptive gingivitis due to fusobacteria. Recuerda, cuando tú ves ulceration in the gingiva, remember about pellagra. Pellagra is a vitamin C deficiency, niacin deficiency. And also remember that phenytoin can cause gingival hyperplasia. Dios mío. Von Gieker disease, Taiwan glycogen storage disease, GC-PTase deficiency glycogen accumulation, bone hypolandal, hemangioma, hemangioblastoma, cerebellum, brainstem, retina, adenomas of the viscera, especially in renal cell carcinoma, chromosome 3. Huntington, chromosome 4. Huntington is also a precipitation in the disease. El nombre es anticipation. And also, it's in the caudal, decreased GABA, and also ¿qué más? Bueno, ese es eso. Von Hypelando. Esto es importante. Porque Von Hypelando recuerda que es un defecto o una mutation en DBAGL. Está relacionado a problemas en the liver, hemangioma, hemangioblastoma, cerebellum, brainstem y retina. Adenomas of the viscera, especially in renal cell carcinoma. Entonces, si tú ves un cara con problema no liver, in the cerebellum, piensa en von Hypeland, cromosoma 3. Von Reckling-Genhausen, neurofibromatosis, Kaufman-Light spots, and Leach nodule, chromosome 17. Entonces, existe neurofibromatosis type 1 y neurofibromatosis type 2. Neurofibromatosis type 1 is in the chromosome 17, Kaufman-Light spot, neurofibromatosis type 2 is shown cells in the problem's eyes. Is autosomal dominant? Yes. ¿Qué más? Von Willebrand disease, defects in platelet adhesion secondary to deficiency in von Willebrand factor. Oh, increased bleed time in APPT. Oh, it's not normal. It's increased. Good. Waldenström macroglobulinemia, proliferating IgM producing lymphoid cells in main 15-17 jaw, past ductal bodies. Wallenberg syndrome, posterior inferior cerebral artery pica thrombosis, medullary syndrome. Esto es un infarto en posterior inferior cerebral artery. Remember that it's going to have vomiting, headache. I think vomiting is very present. Facial pain, temperature, contralateral body, pain and temperature. Esto es importante porque la mayoría son sensoriales. Porque recuerda que la posterior cerebral artery posterior inferior cerebral artery is almost in the midbrain. Waterhouse Frederickson, adrenal insufficiency secondary to disseminate intravascular coagulopathy, to meningococemia. Weber syndrome, paramedian infarct of midbrain. It's a lateral, mediastinal, contralateral, upper motor neuron, paralysis, and lower face and body. Wagner granulomatosis, necroscytic granulomatous vasculitis, or paranasal sinus, lungs, and kidney. Web's disease, enteric leptospirosis, noisy progressive renal failure, myocarditis, dark field microscopy. Weber syndrome, men type 1, thyroparathyroid adrenal cluster, and pancreatitis islet pituitary. Ok, nosotros hicimos una diferencia en main type 1 and main type 2. Main type 1, remember, problem in the thyroid gland, in the pancreatic gland, adrenal cortex, pituitary, and main type 2 estaba en la otra parte. En main type 2. No lo voy a leer. Ok, Wernicke aphasia, sensory aphasia, impaired comprehension. We talk about the Broca and the Wernicke. Remember middle cerebral artery, frontal, temporal parietal, occipital. ¿Qué más? Wernicke-Korsakoff syndrome, thiamine deficiency in alcoholic, bilateral mammillary bodies, confusion, attacks of ophthalmoplegia. Entonces recuerda, un cara alcohólatra in the emergency department can have withdrawal within 24 to 48 hours. Is going to have, tú sabes, taquicardia, palpitations, alterado. Las pupilas se van a estar no recuerdo cómo van a estar las pupilas, pero recuérdate que puede causar beriberi, Korsakoff syndrome y puede causar Wernicke, encefalopatía de Wernicke, yo creo que es. I'm hungry. Okay, Whipple's disease, malabsorptions syndrome with bacteria-laden macrophagus and polyarthritis. Wilson disease, hepatolenticular degeneration. Oye, Wilson, putamen. En Wilson oso, con los ojos así de copper. Yes. Wilson's, hepatolenticular degeneration, copper accumulation, treatment with penicillamine, and decrease in ceruloplasmin. Mallory bodies in the liver, in also alcoholic hepatitis, and chromosome 13. Entonces, cromosoma 13, iron, copper accumulation. No, it's not iron, it's copper accumulation. Cobre. ¿Qué más? Wilcox-Aldrich syndrome, immunodeficiency combined B and T cell deficiency, thrombocytopenia, eczema, IgM, and IgA. Worst-Chaikoff effect, high iodine level, thyroid hormone synthesis. Seker's diverticulum, esophageal, choriopharyngeal muscle above upper esophageal sphincter. Zollinger-Ellison, gastrin secreting tumors of pancreas or intestine, acid recurring ulcers. Rogers disease, interventricular septal defects. Ballard syndrome, floppy various syndrome, women between 20 to 40. Smith syndrome, autoimmune thyroid disease, Hashimoto, and insulin-dependent diabetes. Gutenberg syndrome, combination of septum secunda or atrial septal defect, mitral stenosis, passion. Bueno, about disease es lo que yo dije, ¿verdad? Sobre esto. ¿Qué más? Nosotros estudiamos mucho sobre muchas enfermedades. Estudiamos sobre infarto, endocarditis, pneumotoras. Pneumotoras no estudiamos, pero pneumotoras sabemos que puede ser espontáneo o traumático. Creo que voy a hacer una pausa ahora y después voy a continuar.